Sandra Valtero, and I'm your host tonight, and this is Be Prepared. Tonight we're doing part 2 of emerging infectious diseases. And tonight I have with me 3 guests, and I'd like to introduce my 3 distinguished guests. First of all, to my left, Dr. Donald Craven, who's infectious disease prevention and research at Lahey Hospital. He's also a professor of medicine at Tufts University and Medical School. And he is a visiting scientist at Harvard T.H. Chan School of Public Health. Welcome, Doctor.
Thank you. Good to be here.
Next to him, I have Dr. Alfred DeMaria. He's a medical director and state epidemiologist at the Bureau of Infectious Disease and Laboratory Services at the Mass Department of Public Health. Welcome, Doctor. And next to him is David Henley, Superintendent of the East Middlesex and Suffolk County Mosquito Control Projects. Mr. Henley has been working in mosquito control since 1974, and he became superintendent in 1982. He covers 26 cities and towns. Welcome, David. Okay, let's get talking. There's so much to talk about and so little time. But let's talk about what are some of the diseases that are resistant to antibiotics. Would you like to start, Dr. Craven?
Sure. I think we're primarily focusing about tick-borne diseases and mosquito-borne diseases that affect individuals primarily in the summer and the fall. So the tick-borne diseases, the most common one is
Lyme disease.
Yeah, Lyme disease, babesiosis, and anaplasmosis. All 3 of these diseases can be transmitted by ticks. The tick may transmit 1, it may transmit 2, and in some cases it transmits all 3 diseases to individuals. Individuals who are exposed to these ticks are usually people that are out walking in the brush, in the grasses. They happen to have a dog that's also with them. The dog can bring in ticks, the individual can bring in ticks. There should be tick checks to try to prevent the ticks from attaching. To spread the disease, these ticks have to be attached for a period of time. So that's an important thing to realize. So if we can prevent the ticks from actually biting the individuals, or if they're there to remove them effectively, we can prevent transmission to any of these tick-borne diseases.
David, has climate change affected the influence on infectious diseases?
Well, we've seen a new new mosquito-borne diseases. West Nile virus has come into our area, and we've seen a big change in the mosquito population. In the short time that the East Middlesex project has been monitoring mosquitoes since 1982, we've had a change in our mosquito population. We've had a couple new species move into the area, and we've also seen a change where some mosquitoes that are more common in the southern United States have increased, and mosquitoes that are more common in northern climates have decreased. So particularly there's one species, Staurophora ferox, that has increased 1,400% since 1983. And when we look back at mosquito surveys in the 50s, the 60s, and 70s, we don't even see the mosquito there, particularly the 50s and 60s. So, it's a changing situation and whatever. I mean, also, we did some tick surveys in the late 1980s, and at that time there were no deer ticks in the region. And gradually over time, we found a couple in Sudbury and Framingham, and then over a couple-year period, they just swept through the area. So yeah. It's a changing situation.
It certainly is. So how, Dr. DeMaria, how are we managing infectious diseases in the United States?
Well, I think that we have a lot of challenges in terms of a lot of factors that relate to emerging infections. People travel from the United States to the developing world. People travel from the developing world to the United States, offering opportunities for being exposed to infections that were never part of our concern. And people can travel fast enough now that they can acquire the infection but not develop the symptoms until they've been back for a period of time. So you have to have an increased suspicion for some of these exotic diseases. Now, we don't have the conditions that would lend themselves to transmission of a lot of these infections, but that doesn't mean that they can't cause problems here. The other major factor, especially with mosquitoes, mosquito and tick-borne disease, are the changes in our environment. For example, we did not have EEE, Eastern Equine Encephalitis, in Massachusetts until 1938. But we know that it was present in the 19th century, and we know that it depends on the mosquito that reproduces in the white cedar swamp. But the white cedar trees were all cut down in the 19th century for shingles. And then they came back in the 20th century, and lo and behold, EEE came back. So that's an example of how we change the environment, and that's very critical for a lot of these. And like tick-borne diseases, the ticks weren't here essentially in large numbers. We know that the ticks and Lyme disease were here in the turn of the 20th century, over 100 years ago, because we have molecular evidence that it was present. But it really wasn't a problem until the 1970s, until we changed the environment. The deer came back in large numbers. The mice that carry the infections came back in large numbers. And we have now these ticks spread across the Commonwealth. So we have a risk of tick-borne disease now in the entire state, which did not exist 30 years ago when David couldn't find these ticks in Massachusetts. So the way we change our environment, population density, all contribute to these emerging infections. So we really have to analyze how we change the environment, how we recreate, how we do our recreation. We have to analyze for the foodborne emerging infections what we eat and how we get these food products. So all of this relates to both changes globally and changes locally.
Yeah, a lot of how do we protect ourselves, like for travelers coming to this country? I know there's some airlines that I visited other countries, they'll spray you on the plane.
Yeah,
What does that
that's
do?
controversial, has limited efficacy. The best thing that people can do is just look on the CDC website, so-called Yellow Book for travel.
Yeah.
And it has advice about what to do in general, but it also has specific advice tailored to where you're going, what immunizations you need. One of the most important things that people can do to reduce the risk of infection beyond hand washing, which is the most important thing, but also to be up to date and have all the recommended immunizations, especially if you're a volunteer. If you're in the Medical Reserve Corps, you don't want to not be able to respond because you had shingles because you didn't get the shingles vaccine, or you had pneumonia because you didn't get the pneumonia vaccine, or you had influenza because you didn't get the influenza vaccine. So that's true of international travel as well. People should look. For example, people don't think influenza kills many, many more people in the United States every year than many of the diseases we're talking about. But people need to realize that if they're going to go to Brazil for the Olympics, they're worried about Zika, but they're going to be exposed to influenza out of season in their travels. So they really need to consider getting an influenza shot, because it's going to be in our summer, so what is it in Brazil? It's winter in Brazil.
Exactly. Yeah.
So that's when influenza is being transmitted. So there are a lot of these kinds of things that I think people tend to think of the exotic. They think of Ebola, and with virtually no risk of Ebola, but all these other things, even influenza, can be a risk.
But I was thinking about the people coming to visit us, bringing disease to us. So they
Well, many more Americans travel there and come back
Right.
than actually come from those countries. But obviously, a lot of people come, and I think that's why we have to be prepared, and the medical community has to be prepared to recognize some of these unusual infections, both for the sake of those individuals so they get appropriate treatment, but also so that public health can do what it can do to prevent any kinds of transmission. And again, the risk of transmission is limited here because we have clean water, we have clean food, We have screens on our windows. We have air conditioning, which people in those countries don't have.
Right.
So I think the most important thing is vigilance in terms of infections.
Okay. So how ready are we to prevent the spread of infectious diseases here in this country?
Well, I think we're much better off than 99% of the rest of the world.
Yeah.
But we also, as I said, we have to be vigilant and we have to maintain our surveillance systems. That's what the Department of Public Health does. And we have to be aware of what's going on in the world. And we have to recognize that many parts of the world with these emerging infections that present a threat to us don't have the resources to do what they need to do to control these infections. So we need to continue with international aid. We need to continue, for example, with the President's AIDS initiatives, because that also addresses tuberculosis, a very important disease in terms of the rest of the world, and malaria, which can also be introduced into the United States. And there are a lot of other things that are related to clean water and to food supply and to environmental conditions in the developing world that we, as a rich country, need to take an interest in, not only because of the infections in those countries, but because of the risk of them coming here, the infections, that is.
Do you feel all our states are prepared, Dr. Craven, to, to prevent an infectious disease from spreading in their states?
I think it really depends on the infectious diseases that we're talking about. I mean, we have, we're very lucky that we have vaccines here. The vaccines could be better utilized. There are people that still don't get vaccinated for different reasons, but I think that the country is very prepared for preventing diseases if we can educate people on the importance of prevention, getting the vaccines, being up to date with it. And then for the other diseases that we're talking about now, there are some that we don't have vaccines, but for Lyme disease, dogs that actually can get Lyme disease get vaccinated. There was a vaccine at one time, and then the vaccine was pulled from the market because it wasn't effective, but there are still individuals looking at vaccines as a mode of prevention of these diseases, and I think we have to continue to look for them, as it's an important way to prevent not only spread but acquisition.
So they have a shot for Lyme disease for dogs, but
Yes.
they don't have them for humans.
They did have a vaccine several years ago, but the vaccine was taken off the market because there were lots of complications and it wasn't clear exactly how effective the vaccine was. But there are people now working on a better vaccine for Lyme disease, and maybe in the next year or 2 or 3 we will have a vaccine that will be effective.
Yeah, that would be good. Why is it best to avoid mild doses of antibiotics over a long period of times with these infections?
Well, resistance, what happens is that if you use antibiotics over a period of time, we always worry about resistance, that the organisms can become resistant to it. There's also side effects of the antibiotics that we worry about. But I think right now for certain diseases, early onset Lyme disease should be treated aggressively, because sometimes the blood tests that we use to detect Lyme disease don't turn positive for 2, 3, or 4 or 5 days, sometimes even later, so that it's important, I think, if we suspect it and there are signs and symptoms that are consistent with Lyme disease, to draw the important laboratory data and to see if there is evidence of Lyme infection. There are also other indications, like changes in the blood count, changes in the chemistries, that can lead individuals to suspect that the infection is occurring, maybe only in the incubation period, but should be treated and followed, and looking and monitoring the response to treatment, so that if a person improves over 3 to 5 days, it's possible that it's effective treatment, or that there's some other disease that was present.
Yeah, I heard that you should take a stronger antibiotics for less amount of time. It seems to be more effective.
Well, I think sometimes the tests don't turn positive right away. It may take 3 or 4 or 5 days for a test to be positive. So initially there may be a screening test for Lyme disease to test Lyme disease that can be negative, but the person still could have incubating Lyme disease. So if there's evidence of fatigue, malaise, anemia, muscle aches and pains, headaches, what we call sort of summer flu, Lyme disease would be very high on the differential diagnosis, and other tick-borne diseases can also have similar symptoms.
Right. That disease that popped up in Rockport, should we be
Babesiosis,
concerned?
yes, another tick-borne disease. It's a parasite that infects the red blood cells, very similar to malaria.
Yeah.
And we've seen an incredible increase in the number of cases. And most people that have babesiosis, some people have life-threatening babesiosis, and it can be a cause of death in and of itself in the unfortunate circumstance. But most people don't have any symptoms at all, and that means that they can donate blood to somebody who might have an underlying disease that puts them at risk of babesiosis, and it can be transmitted, and is now the #1 transfusion-transmitted disease in the United States. So there's a big concern now about screening for it. And all of these organisms are adapting constantly. So that's another factor. And you mentioned antimicrobial resistance. It's a very good example of Darwinian natural selection, that you have a population of bacteria, let's say, that some members of the population are more resistant to antibiotics than others. If you give a full dose and you give it for the proper period of time, even they're destroyed. But if you give a low dose, too low a dose, or you don't take it consistently, or you don't take it for the length of time, they can still be around and come back. And so now you have a population that's a little more resistant than the last population. And the same thing can happen over and over again. So you get this natural selection, the evolution of the bacteria to resistance. And we've seen that, for example, with gonorrhea. One of the most frequent infectious diseases, reportable infectious diseases in the United States. And what we've seen since the 1940s, resistance to penicillin, resistance to ampicillin, resistance to tetracycline, resistance to ciprofloxacin, the fluoroquinolones. And now we're worried about resistance to our last line drug, ceftriaxone. So drug resistance is an important emerging problem, because we've been very fortunate to have a large number of highly effective, safe, and readily available antibiotics, but that may not be true for much longer, because these organisms are becoming resistant.
I see. I know it was easier 10, 20 years ago to control these infectious bacteria.
Right.
And today it's not the case. It's
Right.
getting more difficult.
Becoming more and more difficult.
Absolutely. So do you have any concerns, David, about mosquitoes getting out of hand and not being able to control the...
Well, there's always a chance, like you look at weather and see the massive flooding that occurred earlier in the year in Texas or Louisiana, but you worry about things. No, I think we need to just be prepared. I mean, the Zika virus concerns, we're not worried about Zika transmission yet, but it's caused us to start looking around to say, in Boston, we picked up 700 discarded tires from vacant lots and open space areas. And the mosquito that spreads Zika virus does very well in discarded rimless tires. And so looking at that, it's a big thing. And so we just have to be prepared to see what's coming towards us and, what the strategy should be. And so, we're lucky, I think, in Brazil with Zika virus, because people have to collect water because there isn't a reliable public water supply, and because they don't pick up trash that well, there's a lot of water holding containers that produce the mosquito. Well, in Massachusetts, it's a much cleaner environment. People keep in say Burlington, people keep their property clean, and that's something that we can look at it, and we just have to make sure that things like with rain barrels, new things that come along, that people pay attention. That collecting water in rain barrels, you need to cover them. I mean, there are always new things that are coming around.
Yeah. Absolutely. In fact, I was just talking to someone the other day. He keeps a barrel of water in his yard to water his plants because we can only water once a week here now.
Right.
Okay, and I'm saying, do you cover it? And he said, no. I said, well, that breeds mosquitoes.
Right. And it actually
yeah.
breeds the mosquitoes that transmit West Nile virus. So
Even worse, right?
Right.
Oh my God. I should tell him that. That may make a difference, you know. So what are some of the other diseases that we should be concerned about, or that you guys are concerned about, that could get out of hand here?
Well, there's a viral infection transmitted by ticks called powassan virus, or deer tick virus, and that we're just starting to learn more about that, and we're just starting to see cases, and that can be a very severe infection in people. Although we don't know, it could be that people are carrying it all the time. And most infections that the ticks transmit go dormant in the tick until it takes its next blood meal. So taking the tick off prevents transmission because they have to wake up and get to the saliva. But the virus is constantly reproducing. Again, all of these diseases we're talking about that are transmitted by mosquitoes and ticks have to have part of their life cycle in the tick or the mosquito. So these are not acting like needles and syringes moving blood from, one person to another, or from other species to people. They're part of the cycle of the organism causing infection. So that's why HIV can't be transmitted by mosquitoes. That's why hepatitis can't be transmitted by mosquitoes, because they have to have that life cycle. But the powassan virus doesn't go dormant in the ticks, so we're concerned that we can see a bigger problem with it, because even if you do a tick check and remove the tick, you might still get transmission.
Oh, wow. So
And there's been experience in Massachusetts now with clinical cases.
There's been about 9 cases or 10 cases over the past 2 or 3 years, so it's slowly evolving, but can probably continue to evolve. Once you have it, it's a reservoir. It can spread rapidly, and but that was nothing. We don't even think about that in the differential diagnosis when we see patients, but we have to start thinking about it now that there's cases being reported. And mostly, there were 9 cases reported in Massachusetts over the past 3 years, or so. So it's not completely taking over, but it's something to watch, because it can be a very severe virus. It goes to the central nervous system, can cause a lot of problems with brain encephalitis, cerebritis, things that have bad outcomes. So it's a virus that we would like to avoid.
do we have antibiotics to treat it?
No, there's no antivirals for treating Powassan virus.
Well, that's scary. So it's just like treating the symptoms
Yep, prayer.
and prayer.
Yep.
Now, there's some evidence that most people who have the infection don't have any symptoms, so it may only cause illness in a small proportion of people, like West Nile, like that, and Zika's like that.
Yeah.
80% of people with Zika infection have no symptoms at all. But that raises concern, because you don't really know how much infection there might be out there. And you get back to the blood supply. So and now we have a lot of organ and tissue transplants, and they can come from people with infection, and so it's become an issue of concern in that whole area, which we weren't thinking about these infections 30 years ago. And these were rare infections. We used to have the first case of babesiosis was described on Nantucket. It was an unusual infection. Now we have 200 to 300 reported cases a year.
Wow.
And since most people aren't symptomatic, it must mean that we have thousands of infections. And when you look at blood donors, about 2% in some heavy tick-borne disease areas can have evidence of past infections. So.
Wow.
Now, but babesiosis, there's a very high concentrations, like on the islands, on Cape Cod, the islands, and we're just seeing 2 or 3 cases every two to three cases every other day. So that right now we're in sort of an exponential group. We've been sort of working with the Tufts group that's also seeing a lot of babesia. But for a while, the cases were very small and very limited, but it looks like it's going to be a bigger problem this year.
Wow. And there's no medicine for that one either?
No, there is treatment
There is
for that.
one.
Yeah.
Oh, well, thank goodness for that.
Yeah.
Well, we're running slow on time. We've got about 4 minutes. Is there one last comment you'd like to make, David?
Well, I just want to say from the control side, there really isn't a great control method for ticks. It's something that we're kind of watching to see whether there's an area-wide tick control method that can be used by a public agency, but there isn't right now. And right now, the only thing people can do is you can treat your own yard, you can put repellent on, and you could do tick checks. But you know, I think we probably need to be looking more at the ticks and testing more ticks around in the area to kind of get a better idea of how these tick diseases are changing.
Right, okay. And hopefully they start checking the blood donors for these diseases. Are they doing that yet?
It's about to happen, and it's going to raise the cost of blood, which is another concern. So these are all difficult circumstances. So the best approach is prevention and doing the things that Dave's talking about, as well as personal, all those personal protection things really do reduce risk, and people need to pay attention to that. They need to learn what they need to do in terms of insect repellents, tick repellents, in terms of recreating their environments in a way that reduces risk, checking their screens, getting rid of standing water. All of these things are important. They are all incremental to reduce risk. So that's a very important part of this.
What do you think about screening blood more? Where does that stand? Is that going to actually move forward or not? Because with the numbers of cases of babesiosis now, and there is certainly transmission occasionally by blood that was donated, it seems like it would be a reasonably straightforward thing to screen.
Yeah,
what's the barrier, I guess I would say?
The barrier is that it only occurs in certain parts of the country. So the risk is high in the Northeast, but essentially zero if you get to like Arizona and New Mexico. So do you screen the entire blood supply, or do you screen the local blood supply? And what does that do to the sort of the market for blood? It's a very complicated issue. But I think what we're going to see in the future is deep analysis of the blood. They're actually going to go in and look for nucleic acid of DNA, RNA of things we don't even know exist, and do that as a screen. So,
Well, I hate to cut it short. This is really interesting because there's so much more I'm sure we could cover, but unfortunately we're out of time. Well, in the future we'll have to get you back to get updates on the situation. So again, this is Be Prepared. Please take time to look at these shows in August and in September, because this is important information for your health and welfare. And as we were told, that it's important that we do our own job of protecting ourselves by using protection on our body and clothing, and taking care of our own environment to prevent ourselves from getting all these different diseases that have come about through ticks and mosquitoes. So again, my name is Sandra Valtero, and this is Be Prepared, and I will see you next month. Thank you for joining us.